You ever think about how much we rely on our senses? I mean, like all the time. From that first cup of coffee in the morning to just feeling the sun on your skin
It's true, we kind of take it for granted.
until it goes wrong, right?
Yeah.
And for nurses, well, thinking about how our patients' senses are working, that's got to be crucial, I bet.
Oh, absolutely. It can really make or break their experience, even how well they recover.
So we are diving deep today into sensory experience, all about how it affects nursing care.
And we've got some really interesting research here to guide us, way more engaging than just a boring old textbook, that's for sure.
Okay, I like the sound of that.
One of the things that really stood out to me was how these sources break down sensory experience, like what it actually adds us.
Yeah, break it down for us.
Well, it's not just about our senses taking in information, it's about how our brains actually process it. So there's reception, that's like gathering the data from our eyes, ears, and all that.
Makes sense.
But then there's perception, that's where we make sense of it all, like giving it meaning.
Okay, so it's not just can a patient physically see or hear. It's more like how are they understanding what they're seeing and hearing?
You got it. And think about it, in a hospital, everything's so new and different, probably pretty overwhelming for a lot of patients.
Yeah, I can see how that perception part would be even more important in that setting.
Huge. And you know those beeping machines we have everywhere?
Oh, tell me about it.
We as nurses, we might tune them out, but for a patient, that could be a major source of anxiety, a sensory overload.
Absolutely. Makes you think differently about the soundscape of a hospital room.
It all ties back to how the brain works. It's a arousal system.
Yeah.
The research talks about something called the RAS, the reticular activating system.
Okay, the RAS. Gotta love a good acronym. What's that all about?
Well, it's like this filter in our brains that decides which sensory information we pay attention to. Some stuff gets through, some doesn't.
So that explains why some patients, they need a lot of stimulation to stay alert, while others, like too much is just way too much.
Exactly. And the sources even lay out different states of arousal, all the way from a coma to delirium, helps you picture how different each patient's experience might be.
Wow, coma to delirium. That's a pretty big range. I can see how that would be helpful for a new nurse, getting their head around all these different situations.
Totally. Helps put things in perspective. And, this leads right into a really key topic, sensory deprivation and overload.
Oh, yeah, those were biggies.
The sources go beyond just defining them. They give these real-life examples. Helps you understand why it matters so much.
Was there one that stuck out to you?
Well, they talk about isolation during COVID.
Oh, right.
Being stuck alone, even if it's temporary, can really mess with you. Have lasting effects on how you process things. It makes you realize how vital those connections, that stimulation really is.
Makes sense. And then on the flip side, think about like an ICU, all those alarms and bright lights, that's got to be tough on the patients too.
Absolutely. Sensory overload is a real thing, and it can be just as bad as deprivation, affect their recovery, all sorts of things.
The sources actually get into why that is, right? Like what's actually happening.
Yeah, they explain how both extremes, deprivation and overload, can mess with thinking, emotions, even how well a patient heals.
Wow, so we're not just talking about comfort here.
Yeah.
We're talking about their whole well-being.
Exactly, and that's where nurses come in. We have to be able to spot those signs, whether it's deprivation or overload, and then do something about it.
Okay, so how do we even know what to look for? Sounds like a good sensory assessment is key here.
You're telling me, and the sources, they really lay out how to do a thorough assessment, like what questions to ask, what behaviors to observe, the whole 9 yards.
That's helpful, but it can't just be a one-time thing, can it?
You're right, patient needs, they can change so fast, especially in a hospital setting. We've got to be on our toes.
Constantly reassessing, right?
Always looking for those little cues, even subtle ones, a change in mood, maybe they're restless, or how they're interacting with the stuff around them.
It's like becoming a sensory detective.
Exactly. Got to keep those observation skills sharp. Now, the sources also talk about sensory deficits, which can be a real challenge for anyone, but especially as we get older.
Yeah, aging and senses, not always a good combo.
And some of the changes they describe are pretty specific. It surprised me. Like, did you know that we tend to lose the ability to hear high-pitched sounds first?
I did not know that.
Makes you think about how you communicate with older patients. Maybe you got to adjust your tone or something.
Yeah, good point. And what about phantom limb pain? That was new to me.
It's wild, right? Just shows you that sensory experiences, they're not always straightforward. We got to be prepared for the unexpected.
For sure. So as nurses, we're not just checking off boxes like can they see, can they hear? We're looking for those nuances, those changes that might point to something bigger.
Absolutely. Got to be detectives. And then, of course, we need to know how to help them adapt, make things easier for them.
All right, so we've covered the basics of how senses work, what can go wrong, but the sources also talk about other things that affect our sensory needs, beyond just like illness or getting older, right?
You're right. They bring up things like development, someone's personality, even their lifestyle.
Makes sense. A kid's sensory world is going to be totally different from an adult's.
And think about someone who's used to a super quiet life. Maybe they live out in the country. A hospital is going to feel like sensory overload central.
Oh, yeah, I bet. And what about different cultures? That's got to play a role too, right? Like what's normal sensory-wise can vary all over the place.
Totally. We can't just assume we know what our patients prefer or what they're used to. Gotta ask, gotta observe, gotta be willing to adjust our care based on that.
Okay, so we've gone from the brain to the individual patient and everything in between. That's a lot to think about.
No kidding. But it's all connected, you know? These basic ideas about how the senses work, they really lay the groundwork for understanding why sensory care is so important for nurses.
I'm with you there, and I'm already starting to connect the dots, like how all this applies to different situations I might encounter as a nurse.
That's great to hear. It's all about applying those concepts to real-world scenarios. It's amazing how much sensory experience really does tie into patient care, you know? These sources, they go beyond just the basics and really highlight how important a nurse's role is in making sure the patient's environment supports their senses.
It's making me rethink some of those like standard nursing interventions we do, Like the sources mention how isolating a patient, even if it's for a good medical reason, it can accidentally cause sensory deprivation.
Oh, that is so important. You're right. It's like a reminder that we got to think about the whole picture. We can't just focus on the immediate medical thing we're doing. We have to consider what might happen to their senses because of it.
So it's like asking ourselves, okay, if we do this, how is it going to affect how the patient experiences things with their senses? And then figuring out how to minimize any bad effects.
Exactly. Like, say a patient has to be isolated, infection control, all that. Could we at least make sure they have a window to look out of, or maybe bring in some stuff from their home, familiar things? Little things can make a big difference.
The sources also talked about how someone's background, their life experiences, all that shapes how they take in sensory information. It's not a one-size-fits-all thing.
Absolutely. They even gave the example of pain, like how people feel pain. Two patients could have the exact same injury, but their experience is totally different because of things like past experiences or even cultural stuff.
Right. It's a good reminder that we can't just assume we know what our patients need or what they'll find comfortable.
No way. What one person finds comforting, another might find totally distressing. That's why talking to them is so huge, asking about their preferences, not just deciding for them, I think this will be good for you.
I was thinking about those examples of how our senses change as we get older, like the one about older adults losing the ability to taste sweet things very well. That really stuck with me.
It makes you realize how much we depend on our senses for just basic stuff, like enjoying a meal or even noticing danger. Imagine not being able to smell smoke or taste if food has gone bad.
It's like a whole other level of vulnerability that we as nurses have to be aware of.
For sure. And it just shows how important it is to keep checking on their senses, assessing what might seem like a small change today could be a sign of a bigger problem later on.
It wasn't all about deficits, though. The sources talked about how powerful the senses are for helping people heal and just feel better overall.
That's what's so cool about all this. It's not just about preventing bad stuff. It's about recognizing how the senses can actually help people get better.
Like they talked about aromatherapy, music therapy, even having pets around. Simple things like playing nature sounds or giving someone a warm towel that smells nice, it can totally change their whole experience.
It makes you think about how we could be doing this more intentionally, incorporating those positive sensory things into our care plans.
And it doesn't have to be fancy therapies either. We can make the whole environment more healing just by paying attention to stuff like the lighting, how much noise there is, even how the room smells.
Totally. The sources really emphasized how much power nurses have to shape that sensory environment.
One thing that got me thinking was this concept of sensory poverty. The idea that with all the technology we have nowadays, we might be experiencing the world less directly through our senses.
I think we all feel that sometimes, right?
Yeah.
How often are we just glued to our phones or whatever, missing out on what's actually around us?
And for kids who are growing up with all this tech,
Yeah,
it makes you wonder what's going to happen to their senses in the long run.
that is a really good question, something to think about for sure. And for us as nurses, it's like we have to advocate for a balance. Technology is great, but we need real life sensory experiences too.
Speaking of the real world, the sources also talked about cultural differences and how we perceive things with our senses.
So important because what's normal or okay in one culture could be totally different in another.
The example about touch was really powerful. Like in some cultures, touch is just a normal part of how people communicate, but in others, it's only for people you're really close to.
Can you imagine how a patient would feel if a nurse, even with good intentions, touched them without understanding their cultural background?
Yeah, that could be really unsettling or even offensive. So we got to ask, we can't just assume that our way is the right way for everyone.
Cultural competency, that's a huge part of taking care of someone's sensory needs, and it's something we always need to be learning about and getting better at.
I also thought the part about stress and being sick was really interesting. How stress can make our senses stronger in some ways, but weaker in others.
Makes sense when you think about it, right? When you're stressed, you might notice certain sounds or smells way more, but at the same time, you're blocking other stuff out. It's like your body's way of dealing with it all.
And then if you're sick on top of that, it adds a whole other layer of complexity. Being sick can affect your actual senses and also how your brain processes sensory information.
Yeah, like a patient with a fever, their taste might be off, or someone in pain might be super sensitive to touch.
So it's a reminder that we need to be looking for both overload and deprivation because the same patient could be experiencing both at different times, depending on what's going on.
And that assessment, it has to be ongoing. We can't just rely on one check-in. We got to be tuned in to those subtle changes in how the patient's acting and responding to things.
It's about understanding that sensory care is a process. It's not a one-time thing. It's always changing.
And as much as possible, we should be including the patient in that process, asking for their input, what they prefer, what they're experiencing.
I'm realizing that sensory care goes way beyond just making sure someone has their glasses or hearing aids. It's about seeing how their sensory experience affects every part of their care.
Couldn't have said it better myself. These sources, they've given us a really solid base to understand all this complexity and start incorporating sensory care into everything we do as nurses.
It's definitely changed how I think about approaching patient care, and I'm curious to hear what specific things they recommend. What strategies and interventions actually work.
Well, that's a perfect segue because next up, we're going to dive into some practical tools and techniques that nurses can use to figure out what their patients need, sensory-wise, and then actually address those needs.
Okay, let's get practical. What kind of strategies are we talking about here?
Well, the sources lay out this really thorough guide to sensory assessment, but it goes way beyond just the basics.
Right, because we can't just assess once and assume we're done, can we? Patients' needs can change, like from 1 hour to the next.
Exactly. Especially in a hospital, things are always in flux. We got to be constantly observing, reassessing, looking for any little clues that something's shifted.
So we're not just checking boxes, it's more dynamic than that.
Way more. The sources actually give these frameworks to help organize our assessments, like breaking it down into stimulation, reception, and that whole process of how sensory information gets transmitted, perceived, and then how the patient reacts.
I like that, having a structure like that.
Yeah.
I bet it's really helpful for new nurses who are still trying to figure out what to focus on.
Totally. It gives you a system, make sure you're covering all the bases, and they even give specific examples like what questions to ask, what to look for in the patient's behavior, really useful stuff.
Sounds like a great resource to have on hand, even for experienced nurses.
Yeah.
Just to refresh your memory.
Absolutely. But the sources also make it clear that assessment isn't just about this formal process, it's about being aware all the time.
Okay, so how do we do that?
It's about weaving sensory observations into every interaction we have with patients. Those little moments when we're chatting with them, helping them get dressed, or just watching how they're doing, those can tell us so much.
It's like we have to tune in to those nonverbal cues, their facial expressions, their body language, even the tone of their voice.
Exactly. Those cues give us a window into how they're feeling, how they're experiencing their environment, even their own bodies. And sometimes just asking a simple question like, hey, how are you feeling today, can open up this whole conversation about their sensory needs.
Okay, so we've talked about assessment, but what about actually doing something? What do the sources recommend for addressing sensory needs once we've identified them?
They've got a whole toolbox of strategies, everything from creating a calm environment to actually providing more sensory stimulation. And they stress that the best interventions are tailored to the individual patient, no one-size-fits-all approach.
Makes sense. What works for one person might not work for another. So like if someone's overwhelmed, experiencing sensory overload, we might try to create a quiet space for them. Dim the lights, minimize distractions, that kind of thing.
Spot on. But for someone who's feeling deprived, not getting enough stimulation, We might encourage them to listen to music, watch TV, maybe have some visitors, stuff that engages their senses.
The sources also talked about things like aromatherapy, music therapy, even pet therapy, incorporating those positive sensory experiences.
It's about remembering that our senses can bring us joy, comfort, and we can use that to create a more healing environment for our patients.
I love that it's not just about fixing problems, it's about making them feel better on a deeper level.
Absolutely. And we can't forget about safety. The sources really emphasize that, especially for patients with sensory impairments.
Right, because those impairments can make them more vulnerable to falls, medication errors, all kinds of bad stuff.
Exactly. So for someone with vision loss, we might need to help them walk, or if someone can't hear well, maybe set up a visual alarm system, things like that.
And we need to be checking the environment, making sure there aren't any hazards like clutter, uneven floors, poor lighting. Little things can make a big difference in preventing accidents.
No tripping hazards allowed.
And then there's the communication piece. The sources give some good advice for communicating with patients who have sensory impairments.
It's all about being mindful, Like for someone with vision loss, we might need to describe what we're doing before we touch them or use really clear verbal cues. And for someone with hearing loss, we got to face them directly, speak clearly, maybe use visual aids to help get our message across.
Makes sense. And for patients who are confused or disoriented, I remember the sources recommending that we stay calm, use simple language, and keep reminding them where they are, what's going on.
Consistency is key in those situations. Using the same words and phrases every time can really help ground them, when they're having trouble making sense of the world around them.
We've covered a lot of tough situations here, but the sources also talk about a topic that can be especially hard for nurses to deal with, sensory changes that happen when someone's dying.
That's something we all face in this profession, and it can be really tough to know how to support patients and their families during that time.
It's true, as the body starts shutting down, our senses often fade, and those changes can be scary for everyone involved.
The sources really stress the importance of being sensitive, compassionate, and explaining that these changes are a normal part of the dying process.
And we can offer practical help, like making sure the room is well lit, speaking clearly, offering comforting touch, those kinds of things.
It's about creating a peaceful, dignified experience, recognizing that sensory care is part of whole person care, right up until the very end.
And speaking of whole person care, the sources also highlight how important it is to educate our patients and their families about sensory issues.
Right, we got to give them the knowledge and resources to manage these challenges. So we might teach a patient with hearing loss how to use hearing aids, or someone with vision loss about assistive devices.
It's about empowering them to take control, to be active participants in their care.
And we can connect them with support groups, community resources, so they know they're not alone in this.
It's a good reminder that sensory care doesn't end when they leave the hospital.
It's an ongoing journey, and it's amazing to think about how much technology has advanced to help people with sensory issues. We've got screen readers for vision loss, closed captioning for hearing loss, even virtual reality that can create these immersive sensory experiences.
It's pretty incredible how technology can bridge that gap,
Yeah.
help people live full lives, even with sensory limitations. And who knows what they'll come up with next. It's exciting to think about.
Sensory care is definitely a field that's always evolving. We got to keep learning and stay up to date to give our patients the best possible care.
I think the main takeaway here is that sensory experience, it's a core part of being human. And as nurses, we're in a unique position to advocate for our patients' sensory needs.
I agree. It's about understanding that sensory care isn't just an extra, it's essential. It's part of holistic, patient-centered care.
So as we wrap up this deep dive, we want to leave you with something to think about. Imagine a world where sensory assessments are just as routine as taking vital signs, and where every patient's sensory needs are recognized and addressed. What can you do right now to help make that vision a reality?
That's something to ponder. Until next time, keep diving deep.